All right, welcome everyone to the the TA Network World Behavioral Health Learning Collaborative presentation on creating a more equitable system for stakeholders with diverse SOGIE, sexual orientation, gender identity, and expression. We've got some great presenters today that I'm really looking forward to hearing what they have to say. I know that y'all will all enjoy it as well. We have Angela Weeks, who's the project director with the National Quality Improvement Center for LGBTQ2S children and youth in foster care. Rob Warnoff, executive director with Sanctuary Palm Springs. And Jessica Jimenez, who's with the Clara Center for Families in Texas, in a rural community in Texas. So we'll get to that in those presentations in just a few minutes. Just a little bit of housekeeping. My name is Shannon Robshaw, and I'm the lead content person for the World Behavioral Health Learning Collaborative for the TA Network. And Sarah Warner works with me at the TA Network and providing support to the learning community as well. We would invite any feedback that you have directly to us, along with any suggestions that you may have for other topic areas that you would like to see this learning collaborative take a look at in the coming year. There was also going to be a survey at the end of the webinar today. We would appreciate y'all staying on. It will only take just a minute or so just to click through very quickly and give us some feedback on the webinar today. We appreciate that. Since you've signed up for this register for this webinar, you will receive a copy, an email link to the video of the recording when it becomes available, along with the PDF copy of the presentation. You can also download that presentation now under the files listed box there at the bottom of your right-hand bottom of your screen. Since you've registered for this webinar, you will be added to our rural listserv, which will continue to receive the recorded webinars going forward, and also any other resources that we want to distribute out to the listserv. If you do not want to be on that listserv, please just email either Sarah or myself and let us know, and we will remove you. But if not, then we will keep you on the listserv to have access to those resources. So first, let's start out by kind of getting a sense of who all is with us today on the webinar. We've got a couple of little polling questions. So my organization can best be described as, please check one. Let us see. So local mental health, state, tribal, territory, or local mental health, most prominent. Let's see. Other. If you in rural research, thank you, Bonita, for letting us know. Yeah, please specify in the comment box. The comment box is also how we're going to be taking questions today, so please feel free to type any questions that you may have throughout the presentations. We'll have particular opportunities for questions as well. Local System of Care Coordinator, Chairperson for the Indiana LGBTQ+ Council, legal organization. All right, very nice. Okay, well, I think we can probably, Gary, close the poll. Yeah. Okay, thank you. So we have a variety of folks, organizations. Now, if you could just tell us your role as best as you can of how it fits. Executive leadership, project director of a SAMHSA grant, called CLC lead. That's interesting. Youth support provider. Very good. All right. Executive leadership, glad to see that. All right. So attorney representing LGBTQ youth and state care. All right, very good. All right, I think we can close that up. Thank you all. It helps us to know kind of who all we're speaking with on the webinars. All right, so I'm going to turn it over to Angela Weeks, who's going to be our first presenter for today, and let her lead it from here. Angela?
Perfect. Thank you so much, Shannon. And thanks, everyone, for joining. We have the agenda posted up here. So this webinar, you were going to go over some highlight some disparities in health outcomes for young people with diverse SOGIE. And again, Shannon mentioned this, but that stands for sexual orientation, gender identity, and gender expression. A lot of folks use LGBTQ as an acronym to describe young people who identify as lesbian, gay, bisexual, transgender, and questioning. And we might use it throughout the webinar too, but to say diverse SOGIE is just a little bit more broad and a little bit more inclusive. So you'll hear us say that throughout the presentation as well. So we start off with highlighting the disparities because in your work, and maybe some of you have even asked this question, a lot of folks will wonder why this population and why have a focus on this population. And so I think it helps to highlight sort of what the current conditions are in care for young people with diverse SOGIE to help get the work started to improve those outcomes. We'll also go over some basic SOGIE 101. So I'll go over some terminology that's important to know and some concepts before we dive into what the main purpose of this webinar is today, which is implementation. So I'm going to talk a little bit about what I think are really great first steps for implementing any kind of progressive work around this population, whether that be you're bringing training to your organization, or maybe you're bringing new programs to your organization, or maybe you just want to create a safe space for young people with diverse SOGIE. So I'll talk about sort of what are some first steps you can start on right away, even if you're starting from ground zero, that can help get you to whatever goal you have in mind. And then we do have Rob Warnoff, who has many different roles, and I'm sure he'll be able to explain them a bit more once we get to his section, but he has just worked across the country in all different types of jurisdictions, and he can really bring a lens to some of the stories and some of the things that other folks have done in rural jurisdictions and agencies that may not be in a large city where they can pull from existing resources. And then we'll hear from Jessica as well at the end of the presentation, and she's going to talk about Heart of Texas, lessons learned and progress. So we have a couple of polls to get us started today. So one of the things I'd like to hear from folks are how you would describe your current knowledge base on the LGBTQ population and their needs in care. This will just give me and the other presenters a little bit better understanding of where to focus our attention today. So if you could just type your answer in there, or you could chat, put in the chat box, that's fine as well. Okay, a couple of moderates. I love the vast, yet always learning. All right, some folks that are just starting out. Great. So it seems like we're all over the spectrum and sort of what we know and sort of what we've been exposed to, and that's great. We're going to go through a lot of information today, so if it seems too fast or if there are questions or you'd like clarifying information on anything, please feel free to post that question in the chat box, and we'll try to circle back to it at some point. So let's go ahead. We have a second poll here. I think will be popping up. Yeah, so how many LGBTQ trainings or webinars have you attended that you can recall? Okay, so folks, some have attended many, and others, this is their first one. Okay. So same here, so kind of all over the spectrum. So that's great. We can move forward from the polls. I think this is helpful to just give us an idea of how much or how little to cover in certain sections. So we're going to show a quick clip. I have a couple of videos throughout the presentation because I think it's great to hear from folks that have lived experience, and videos is sort of one of those platforms. So we're going to pause here for a second, and you'll get to hear about Lily, who has really been impacted by multiple systems of care.
And just a quick note for the audio for the videos, that's going to come through your speakers on your computer. So if you did dial in for the audio, go ahead and put your phone down and make sure that you turn the speakers on your computer up so that you can hear the audio for the video.
The first time I got into the juvenile justice system, I was 12 years old, and around that time, I had just began to understand and learn who I was as far as my identity and my gender and sexuality was concerned. And it brought a lot of problems in my home life, especially with my father, because he was very abusive. And he was not at all supportive of, the fact that I no longer, was his son, that I was his daughter. At home, I didn't feel like I was loved. At a very young age, I had problems in school, like being picked on and being bullied, and it got so bad to the point where I didn't want to go back to school. When the state found out that I no longer was going to school, they took custody of me from my parents.
Anytime you talk about taking a kid out of their home, you necessarily have to admit that you're going to do some harm to them. Now, maybe you have to do a balancing act and say, okay, well, based on the harm that they're already being exposed to and the potential for a greater harm, I think it's important that the court may see we have to remove the kid from the home. But you have to recognize that you're going to do harm to them.
Lily was referred into family court when she was young. She was placed in a group home, and the group home was not at all equipped to work with LGBT young people. Some of the staff, they did not intervene in fights that would happen.
There was an individual in the group home that I was at that used to particularly bully me more than everybody else. And so this person used to physically attack me. I had to fight them back. I was charged with simple battery. They put me into the juvenile justice system, and I became a ward of the state.
Once Lily was in the youth prison, she had a really difficult time. She was in an all-boys facility. She was experiencing the same things that all youth experience when they're removed from home and placed in a youth prison, only magnified because she identified as transgender.
In detention facility, there's a lot of safety concerns for young people who are LGBT. In particular for transgender youth, if a transgender girl is placed in a boys' detention facility, she's really at very high risk for physical and sexual abuse in the facility, but at the hands of her peers and also at the hands of facility staff. Recently, we heard of a problem where a transgender girl who was housed in an all-boys detention facility, she was forced to shower with the boys. And when she did, she got a ticket, a discipline ticket, for flashing her breasts in the shower. It's unfortunately not uncommon for staff to actually encourage abuse of a youth who's out.
Okay, going to give people a few seconds to mute their computers and hop back on the phone. The reason that I like to show Lily's story is because Lily does encounter multiple systems of care, and her story starts in the home, where maybe a family program, early intervention might have been useful when Lily was experiencing rejection or a lack of acceptance in her home. And then she had trouble in the school system with constant bullying and not being supported in that. And then you see how that sort of led her into the child welfare system when she stopped attending school, and then from there, because there was not proper programming or staff reaction or policies, then that led her to the juvenile justice system. And this is not an uncommon story that we hear of, but there's plenty of positive stories as well, but I think that this highlights sort of the why we talk about this and why it's important to talk about this, and sort of introduces some of the statistics that I'm about to show you. So it's definitely a very heavy story to start off with because there is a lot of, there's just a lot of cringeworthy moments throughout the story, but it highlights the importance of just working across systems and early intervention and why this work is so important. So let's jump into a couple of the statistics that I want to highlight. So I wanted to bring in something from the child welfare system. Currently in our population, it's estimated, about 8 to 10% of the general population identifies as having diverse SOGIE, and that number is sort of always shifting, but it hovers around the 8 to 10%. And in the child welfare system, it's estimated that about 1 in 5 youth identify as having diverse SOGIE, and that's important to just highlight the disproportionality in the child welfare system. And this specific statistic is out of the LA Foster Youth Survey that was conducted in Los Angeles, but similar studies have been conducted that show even higher numbers than that. So there's a study by the Center of Study in Social Policy that is called Out of the Shadows, and they found about 1/4 of young people that they surveyed identified with diverse SOGIE, and they did a cross-country study, so that's worth looking into. And then there have been some counties that I'm working with that are finding even as close to 1/3 of their population identifies with some diverse SOGIE. So this number varies and is not just a Los Angeles-based number, but it definitely highlights that there are more young people with diverse SOGIE in the child welfare system than many people assume. The next one is suicidality. So this is probably not a surprise to folks, especially since most of you are coming from the mental health field. LGBTQ youth are twice as likely to attempt suicide than their non-LGBTQ peers. And this is a statistic that sort of lumps together young people with diverse sexual orientation, but also diverse gender identity. And it's important to note that the numbers, if you were to separate out trans youth, and even if you went a step further to separate out trans youth of color, those numbers would be a lot higher, so keep that in mind. But definitely there's an overrepresentation of young people who have either self-harmed or who have thought of suicide or attempted it. The next one is another sort of child welfare specific statistic. So 30% of LGBTQ youth in the foster care system report physical violence by family members after disclosing their sexual orientation or gender identity. So I like to bring in this statistic because I personally feel very strongly about early intervention programs for families when their young person first comes out in the home. And currently I'm working with several child welfare agencies that are testing a few of these interventions. But if you're considering doing any programming for family, I think that is a worthwhile venture and can definitely be helpful, because that moment where that young person comes out in the home is sometimes sort of a make or break moment for them and their family. And so if you do have some type of programming there, or you're thinking about it, that can be helpful. And the last one here, I wanted to bring in something that highlighted our criminal justice system. So 20% of youth in detention halls identify as LGBTQ or gender nonconforming. So that is also an overrepresentation, very similar to the numbers found in Los Angeles in the child welfare system. So just keep those overrepresentations in mind. I think if the folks on the phone call today are sort of the leaders in their organizations wanting to do this work and wanting to just sort of like lead their staff or their leadership towards more inclusive LGBTQ programming, it's important to have statistics like this in your back pocket, because people are going to ask why, and they're going to want to know why this population and why this urgency. And so sometimes bringing in these statistics can help paint a picture for folks. So going from there, since we did start off with a heavy video when we were listening to Lily's story, I wanted to bring in also a positive story. So we're going to hear about a young person who is in a very affirming home.
One woman who opened her home and her heart is Mary Keene, who lives in Yonkers, New York.
This is my house. Come on in. This is my daughter Fanny, who has been with me since '07. I first decided to become a foster parent, actually it's 13 or 14 years ago now. I began to find out a lot more about foster care and why kids were in care. They had food, they had clothing, and they had shelter, but there was no one in their life, no one cared about them. I was in a position to do something, I said, I'm gonna.
Mary's original intent was to foster lesbian teenagers, but through the years, she fostered 12 LGBTQ and straight teens.
It's not safe for kids in care. They have a couple of lesbian, gay, queer group homes and things like that, but that doesn't solve the problem. And these kids shouldn't even be isolated like that. They shouldn't have to be isolated. They should be safe wherever they are. So my thing was just to provide like a safe place. All right, so this is Fanny's room.
I don't know, 2 closets, a fireplace. I was in care about 8 or 9 years before I met Mary. In other homes, I wasn't really able to be myself. It wasn't until I moved here where I was able to listen to the music that I wanted to and dress how I wanted to comfortably. And meeting Mary and just coming to live here made that process as a teenager so much easier because, you know, Mary's gay and even if she wasn't, just the house, the kids, the environment was so positive. I feel like I'm the 1% of the foster care system that finds that safe home where, I mean, you could just relate to your foster parent on like 100%. It feels like how did I end up getting this lucky chance? Like, how come all kids can't have this exact same experience?
Okay, great. I love the Mary Fanny story because it's not often that you hear of these positive stories that are filmed and that you'd be able to share with others. But I think it's so great because the things that Fanny expressed were very simple things. They were things that we all want. Every person wants to feel accepted and welcomed and comfortable. And in the end, that's sort of what Fanny highlighted as the most important thing. She said, I was able to wear the clothes I wanted to wear and listen to the music I wanted to listen to. And I think that speaks to, you know, the hope in this work that it really can be simple once you get folks on board and you help them understand sort of the importance of what we're doing here. And so just want to close off the statistics part with a positive video, because even though, you know, the mountains certainly seem high for us to climb, it is something that is worthwhile and can be easy once you get past the big hurdles. So let me go ahead and move on to our SOGIE 101 section. So this is going to be a very brief overview for folks. And I know some folks, this is your first exposure to these terms. You know, feel free, again, to ask questions in the chat box if I'm skimming over stuff. And also, you'll be able to reach out to me and the other presenters if you have any questions. Our contact information is at the end of the webinar. So I want to go over these 4 basic components of identity that I think are really important to these conversations. And if you already are familiar with these terms, you know, try to think of this section as maybe sort of absorbing or taking notes on how you might explain it to other people. I think this work can be hard, in part because folks don't understand these components. And so once you get people on board with these terms and they start to understand the different components and how they interact together, I feel like it's a little easier to move the work forward. So let me start with sex assigned at birth. So these spectrums, you can see all 4 of them here of the things I'm going to go over today. They each have sort of these endpoints to them. And for sex assigned at birth, it's female and male. Now, these ends of the arrows are representing what we call the binary. And that just means that in our culture and society, often we think of these things as being 2 concrete choices. You're either male or female, and there's no sort of variation or diversity outside of those 2 binaries. But actually what we're trying to represent here in this graphic is that the binaries continue and are not alone. There's actually a lot in between these binary ideas that we have. So for sex assigned at birth, this is talking about anatomy, and I want you to think just about anatomy. So it's just, you know, what a doctor determines or uses to determine whether a baby is born a male or female. And in this modern age, like lots of times this is done way before birth, even through tests, right? But typically there's only two choices that people usually think of. In actuality, there's a lot of variations of sex assigned at birth that people don't know about. Intersex is the term that we're using here to describe lots of different variations of either chromosomes or anatomy, reproductive anatomy, and even hormones. And this is a very large category. There are hundreds of different kinds of variations that people can be born with of all of these different components that would make them sort of not exclusively male or not exclusively female. And so that number of variations is important to think about because it deserves to be acknowledged and validated. And we're not just talking about a binary, right? We don't just have two choices. There are actually lots of different ways that people can be assigned to sex. And so this is also a very common thing in human births. We have about 1 in every 40 births is a young person who has some type of intersex variation. So to give you some comparison, that is about the frequency of redheads in our society. So if you know a redhead, maybe that 1 in 40 will stick out to you a little bit more. But this actually happens, these variations happen very frequently, and we just don't talk about them. And that's sort of how the binary functions. It creates no space for conversation around anything else that's diverse. So that is our first spectrum we're going to talk about today, sex assigned at birth. And again, we're just talking about the things that we use to determine whether a baby is intersex, female or male, which is mainly just anatomy, chromosomes, that type of thing. So I'm going to pause here because we have another video on that'll give us a little bit more depth to what intersex means.
I'm Pigeon.
I'm Alice.
I'm Emily.
I'm Cypher.
And we are Intersexy.
Intersex describes a person who doesn't fit the typical definition of male or female.
I have XY chromosomes, but typical female genitalia.
I'm a girl who has testes and XY chromosomes.
I identify as a queer, gender nonconforming intersex person.
I identify as a black intersex man.
Intersex is not new. It's been around since the beginning of human existence. I mean, there's probably even intersex dinosaurs, if you think about it.
Transgender has to deal with your gender identity, whereas intersex has to deal with your biological characteristics.
Often, intersex people get surgeries that they don't want, and transgender people have to fight for surgeries that they do want. They gave my mom the excuse that the internal testes were cancerous, that I would develop cancer.
They didn't even come up with an excuse, basically, in terms of a health-related reason. They instead just said it was about the appearance.
A lot of doctors are very uncomfortable with the idea that I have testes, and they're still trying to get them removed, but I'm perfectly healthy and there's nothing wrong with them.
They did a surgery to remove my testes and told my parents to take me home and just raise me as a girl, and I didn't find out about it myself until I was 12. There aren't a lot of options, or medical providers don't explore other options. My mom would put me in dresses and she would be like, "Oh, aren't you so cute and you're so pretty?" And I would be like, "No, this is horrible." I was put on hormonal treatment, which consisted of estrogen and progesterone. I just wanted to belong. I wanted to fit in. I didn't want to be different. So even though I knew something felt amiss, I conformed. He was very condescending. He was like, "You intersex activists don't know what you're talking about."
It's difficult for intersex people to find each other because from an early age we're told not to talk about our bodies.
I did feel like I was the only one.
My doctors always told me there was nobody else like me, and so it just perpetuates a vicious cycle of shame and stigma that we can't break out of. I would tell another intersex person that you are worthy, you are lovable.
Your body is beautiful, you're beautiful.
Intersex people don't need to be fixed. There's nothing wrong with them.
I know you feel like you might not be able to get through this. I know you might have really dark thoughts, but I want you to know that meeting other intersex people and finding a community or a support group can be one of the most important aspects in your healing process. And we're out there, we're out here, we're here. And I just hope you can find us.
Okay, great. So I love this video because it's coming from folks with lived experience who are explaining it. It says the way they explain it is just so simple and easy to understand. And it's also, I think, nice that they talk about multiple identities. So they, talk about, some of them talk about their intersex experiences, their variations, but they also very clearly identify their gender identity. And the reason that is because sex assigned at birth, the first line that we just went over is different than the gender identity, which is the line we're about to go over. So gender identity is the second component that we're going to talk about, and it's an inner sense of gender. So no matter how your anatomy was characterized or what sort of anatomy you were born with, everyone has a gender identity. Everyone has a sort of inner sense of gender where they feel very strongly as a woman or very strongly as a man or very strongly as something else. Maybe they feel strongly that they encompass the genders of both man and woman. And so everyone has this internal sense. And so I think that's important to differentiate. Sex assigned at birth, the anatomy we're born with, very different than sort of our inner sense of gender. They're separate things. For some people, they align, and so most of the time people don't even think about it because they align. And then for others, they may have a different gender identity than their sex assigned at birth. So let me just quickly go over a definition here. Some of you may have heard of the term cisgender. Cisgender describes a person whose gender identity and assigned sex at birth align. So meaning if a person identifies as a man and was assigned male at birth by a doctor, then those two things align, and they may call themselves cisgender or would be called cisgender. Now, the other term you may have heard is transgender, and that means it's a description for a person whose gender identity doesn't align necessarily with their sex assigned at birth. So, for example, a baby born and identified as a male will maybe grow up and say, I feel more like I identify as a girl, my gender feels more like a girl, and maybe they grow up and identify as a woman. So that person, we typically use transgender to describe that, that relationship between sex assigned at birth and gender identity. So those are just a couple of basic terms here around gender identity, but even for this line, you can see that we have a binary, right? So we have woman and man, and those are sort of the only two things that we talk about in our culture. And when people sort of step out of that binary into more diverse gender identities, that's sort of where we see a lot of people's discomfort come from or questions around what that means. And so there are a lot of different kinds of genders that could fall somewhere in the middle of this spectrum, but for purposes of simplicity, I just have gender queer here as a representation of just the diverseness that's in the middle of the spectrum. I will say with the term gender queer, this is something that can mean different things to different people. Someone might identify as gender queer, and to them that might mean that they don't feel let's say they feel they encompass both women or a woman identity and a man identity, or maybe they feel like they encompass neither. So for these terms, it's sort of always best practice that if you're sort of unsure of what it means, that when a person, like if they were to come out to you and say, I identify as gender queer, you would say, thanks for sharing that with me. What does that term mean to you? Because it can mean different things to different people, and there are slightly different variations of definitions out there. So I will go forward and sort of talk about a few more that fall in the middle of this gender identity spectrum. So you might have heard of non-binary identities. Non-binary is an umbrella term to sort of house all of the identities that don't fall in the binary of woman or man. And there are lots of different kinds, but here are just a few examples. So I just talked about genderqueer, and then there's something called bigender, so maybe someone who is like, I identify very strongly as both a man and a woman. And then there's agender, so this may be someone who says, I don't identify as either, or I feel like I might be genderless. And then there's someone, if someone identifies as gender fluid, it might mean that they go back and forth. Maybe some days they feel very much like a woman and some days they feel very much like a man, but they're comfortable in that fluidity. Now, all of these definitions that I just gave can be totally different for other people. So I would just say again, always there are slight variations on our understanding of them. So always, if your goal is to understand a person more fully, I think it's okay to ask, thanks for sharing that with me. What does that mean to you? Because people might have different takes on these terms. It's sort of important to just remain open and flexible for, whatever someone is feeling in the moment. So that's gender identity. And now I'm going to talk about gender expression. So gender expression is something I feel like all people sort of resonate with a little bit more strongly. This is something that we often think about, and it's because it's the way we express and communicate our gender externally. So this may be mannerisms, hobbies, jobs, the gender roles we pick up in society, and most often thought of sort of like the things that we wear, our hairstyles, makeup maybe. And so the binary for this spectrum is feminine and masculine. We usually only think of those two things as the two options in our society that are available. But there's also lots of different styles sort of in the middle on this spectrum, and one of them is androgynous. And so for a lot of people, androgynous means that it's maybe not identifiable as either feminine or masculine. So it's in the middle. And so I often, when I think of examples around androgynous style, I often think of work uniforms that like all people would wear the same uniform. And so typically those uniforms are more androgynous. There's not a style that's either female or feminine or masculine. So that's one example, but certainly you could sort of Google androgynous style and see lots of different examples online if you were curious. So I want to take a couple of seconds to just do a poll around gender expression. So we're going to do a word cloud. And what that means is that as people type in words into this poll, they'll populate and sort of create a little cloud of words. And so the first question are, what are the terms that you associate with being stereotypically feminine in our culture? So just go ahead and type in any terms that you can think of that come to mind that you think would be stereotypically feminine. So I love what's coming in. Ladylike, delicate, soft, pretty, girly, emotional, dainty, weak, sensitive. These are all, I think, so connected to what we hear about women and feminine expression. Nurturing, motherly. Yeah, so I think you could see sort of the words that are larger. That typically means that multiple people typed in that word. So this is what we typically think of when we think of, feminine qualities. A few people typed in as well, submissiveness, soft. Yeah, those things are all things that are pretty typical. You could go anywhere in the United States and ask this question, and pretty much people would come up with similar answers because it's so strong in our culture. These sort of ideas and comes through the media, the way we're reared as young children and socialized throughout our life. So let's go ahead and we're going to ask a similar question. We're going to go to another word cloud, and this time we want to hear what are the terms you associate with being stereotypically masculine. So I saw strong, athletic, masculine, I saw aggressive. Yeah, all of those things I think are very similar to what I've heard other folks say as well when asked this question. Those are pretty typical answers and very different than the previous list that we, that we just came up with around femininity. So one of the things that I like to sort of just sit and think about a little bit is based off of what we know to be stereotypically feminine. If you think about those words like dainty and small and submissive and quiet, cute, and all of those terms that we had for the feminine qualities, and then compare that to the masculine qualities, the strong, aggressive. Oftentimes I see like leaders, like they're often thought of as leaders. They take charge, they're very direct, those types of things. If you were to think about those two things in the binary, as typically is sort of structured in our society, where would you fall in between those? Do you feel, so here's the third word cloud, so do you feel like you fall perfectly into the stereotypical feminine or masculine traits that we just talked about? Go ahead and type anything in. You might say, fall into feminine or masculine, or you could say both or neither or in the middle. Yeah, lots of folks are putting both in the middle, and I would say that's very similar to lots of people. And so I like having this conversation this way around gender expression because a lot of it resonates with a lot of people. Not very often do folks fit into binaries, but I think gender expression is sort of where people have a little bit more flexibility culturally around it. And so, it's helpful to talk about it and have people think sort of where they fall on that spectrum, because it does highlight sort of how restrictive the binaries can be, but also sort of gets people to just think about how sometimes they may be fluid, like maybe one day they're a little bit more masculine and then maybe the next day they want to be more feminine. So they may be fluid in their gender expression, or maybe they feel like, oh, maybe I'm more androgynous or in the middle, or I have traits of both. So if we talk about it in this way, it kind of helps to understand the diversity in the other binaries. Great, so let's move on from this word cloud. Thanks everyone for participating. So a couple of other notes on gender expression. So one thing I want to say is that it's very cultural, and it changes throughout history. So depending on where you are culturally, the rules about gender expression could change. Also, it's changed historically over time quite a bit. So back in the day, a couple of centuries ago, pink was a very masculine color. And also the men in most European cultures were the ones to wear high heels to make them have a taller stature. And then eventually over time that changed when women started wearing them to also sort of compete with height. It became a feminine trait. So the reason I bring that up is because it's important to consider that gender expression, and this includes sort of gender roles and just like, the way that we expect people to dress and behave, is really culturally influenced and enforced. So basically a culture or society will decide on what the rules are for a particular gender, and then the culture usually adapts those or adopts the rules, and then they will enforce it as a community. And so you see this happen a lot. And I think that's something that's really important to ponder about, just sort of sit and think about that, that concept, that these are things that are culturally created, and then we enforce them together as a community. So one example of this is if you've ever been in any kind of, I'm sure this happens in any setting. It could happen at a family dinner. It could happen in your workplace. But you might have heard someone say to another female-bodied person or another person who identified as a woman, oh, you should grow your hair out, or you should wear heels to work, or that's not very ladylike, or why don't you wear makeup, or why haven't I ever seen you in a dress? So if you've heard these terms before, I don't think that they were said maliciously or to hurt someone's feelings, but it demonstrates how how the enforcement of these rules comes to play in our everyday lives. So our culture has adopted that there's a certain way to be feminine and a certain way to be a woman, and then you hear people ask questions like this. That is the enforcement of those rules in action. And for folks that have diverse SOGIE, this can be an uncomfortable experience and also demonstrate a lack of sort of acceptance or openness to things that are outside of the binary. And this also happens for male-bodied people or people who identify as men. So you hear things like, don't be such a wuss, don't be such a girl, man up, or why haven't you grown out a beard, or you should cut your hair, like men should not have long hair. Like all of this is, you know, those examples of enforcement in action. So I think that's important to consider, because if you are, you know, if your aim is to create a safe and open environment for young people and families to feel supported, sort of paying attention to those cues and those enforcements of gender expression and gender roles are really important, just so that you can stop them and replace them with more open statements, and so that when people are interacting with you and others in your organization, they know that they're safe to be who they are and there's more flexibility and openness. The last section here that I'm going to go over is sexual orientation, and this is just, I want you all to think of this as just attraction. It's just attraction for another person. And so the binary that we have represented here, on one side we have heterosexual, which typically is used for people who are attracted to the opposite gender. And then we have lesbian and gay on the other side, which typically is used for people who are attracted to the same gender. And then bisexual is the term we have in the middle to represent the diversity of sexual orientation. But there's a lot of different sexual orientations. You know, like many of the spectrums we talked about today, there's so much diversity in these. You may hear people identify as asexual, pansexual, demisexual. There's lots of terms, and I encourage folks to, you know, give it a look online if you haven't heard of those terms before. There's some glossaries that are out there that are pretty great. But bisexual actually is a term that has often been used to describe someone who's attracted to two genders. I would, you know, urge everyone to sort of pay attention to this term because it is evolving and the definition is changing. A lot of people in the bisexual community have actually come out to say that that is sort of an inaccurate description, and that bisexuality to them means they're attracted to multiple genders. And so just something to pay attention to. I'm learning myself and keeping track of the changes that are happening, so just keep an eye on that. But basically, we're using it here to just, you know, demonstrate the diversity in the spectrum. So when you think about attraction, oftentimes sexual orientation is, you know, a lot of people go straight to sexual behavior or like acts of sex when they think about sexual orientation, and I think that's what causes a lot of confusion for folks around what having diverse sexual orientation even means. And so what I like to do is walk people through a conversation around what is attraction really, and it really starts, you know, at your first crush, whatever first crush you had, or maybe it was a recent crush. You have involuntary reactions that you experience, like you know, when you're by your crush, your hands may get clammy, you may get nervous, you may get super excited and happy, and maybe you have like butterflies, right? Like all of those things are involuntary. You wouldn't be able to sort of be like, you know, hands, please stop being clammy, or like, you know, stop blushing or stop having butterflies. So those are involuntary experiences that occur when you're attracted to someone and you're around that person, right? And so that's the sort of like simplest way that I boil down feelings of attraction. So what that means is for folks who are lesbian and gay, they have butterflies for people of the same gender. And for people who are bisexual, they may have butterflies for people of other genders, right? And so I think explaining it to folks on that level helps them separate out sexual behavior from, you know, what is very like normal and common and healthy for people to have, which is just normal feelings of attraction. So that is sort of a really quick rundown, or I tried to make it quick, of those components of identity. I have a couple more things before we get into the implementation stuff. So one thing that I think that you will come up against if you're doing this work in your organization and you're trying to get some movement around equity work is that a lot of folks will present barriers or resistance or even hesitation around changes that may look like special treatment for one population over another. So I hear this come up in lots of different ways. One example could be, let's say you're working in a group home facility and the policy in the group home is that all of the residents, like none of the residents can have hair extensions. And let's say this is a boys group home and you have a transgender girl in that group home and she wants a wig and that's important to her identity. A lot of times staff might say, oh, we wouldn't do that because that's special treatment for this youth. And you'll come across examples that are small like that, but you also might come across examples like, why would we let this young person shower on their own when we have a policy that everyone showers together? Or why would we let this person go to a mental health clinic that's 4 miles down the road when all our other young people get their mental health services on site? So those things will come up in lots of different fashions. I think the thing to keep in mind and what is really helpful when you're having conversations with staff and your organization is letting people talk about equality versus equity. So equality is sort of where we've been living and operating for a long time. We want to make sure that everyone has the same access to the same services, and that's sort of what's fair and final. But actually what we're moving towards and what we should be striving for is equity. So people should just have the things that they need, and sometimes those are not going to look like the same things as everyone else. And so I think that oftentimes when I get into discussions around equality versus equity, and I show this photo or other similar photos like this, lots of times people it just clicks for them and they get it and they're like, oh, okay, I understand what we're doing. Let's move forward. So I just want to have this here as a tool for all of you. It's great to have it in your back pocket and can be really helpful when you're trying to do this work. So with all that being said, I am going to give some tips on sort of if you're starting this work for the first time and you're not sure where to start. So this could be maybe your organization, is midway into a project, or maybe you are the only person in your organization trying to get something started. So I'm just going to impart some thoughts here, and they're going to be quick and dirty because we don't have a lot of time, but I want to reiterate that y'all, if you see something that you'd like more information on, definitely flag it and then let me know afterwards and I can connect with you and give you some more details. So, I think one of the first things that I would encourage everyone to do if they're first starting out in this work is get a dedicated advisory board together comprised of stakeholders from different areas. So I imagine that most people on this call are doing some type of cross-system work. So I would say, having representatives from all of the systems that you work with that have some stake in your policies and your programs. And if you were able to bring at least one person from each of those areas together on a board, it makes the transition so much easier because as you're changing policies or introducing programs, having those people already on board, it just makes life easier. And they also are great in bringing in new insights and things that you might not have thought of. And so sort of like if you do the policy right the first time with all hands on deck, you don't have to go back and redo it. And so that's always helpful. So I would say, number one, get an advisory board together. Once you get an advisory board, the next thing that I would suggest you all do is take a look at your policies. So across systems, if you're doing cross-system work, you want to look at your policies that would affect this population. So let's say your advisory board gets together and you all have a goal of doing, let's say your goal is you want to train all the staff, one, and then you want to provide some clinical services to LGBTQ youth and their families. If those are your two goals, you'll want to do a policy scan to look at what policies could affect these goals across systems. So I have a couple of suggestions or a few suggestions on things that folks should look into. So one is SOGIE data collection policies and privacy policies. So are your staff asking about SOGIE and recording it anywhere? On one hand, it's great to know because then you know who to direct services to and you know how to best help those youth. But also, once they collect that information, how are we safeguarding the privacy of that young person so they're not outed in bad circumstances? So that's something to look into. Anti-bullying policies, especially if you're working like in a school setting or residential setting, those tend to be pretty important. Non-discrimination policies, usually agencies have them, and often they don't include LGBTQ populations, so something to look into. Housing and room arrangements, and this typically comes up when we're talking about trans use, and so that's something to look into. Bathroom and shower policies, also very similar around trans use or gender diverse use. And I would say most of the time I come across this in residential facilities or juvenile justice facilities. Clothing policies and inventories. Sometimes this is a really simple fix, but I've worked with lots of different areas that have very gendered inventories. And so anyone with a female body must buy a bra, they must buy, whatever XYZ clothing, and there's no flexibility for their own gender expression. So that's typically a pretty easy fix sometimes. And then mandated training policies. So, a lot of agencies will roll out training to all of their staff, and then there are staff who refuse to go, and it's helpful to have some type of policy. Like if you really want your staff to be trained on it and you're going to make it a mandated criteria for their sort of, involvement in your organization, there should be something in the policy or some kind of directive that lets staff know that that's an expectation. So I just talked about these two things, so getting an advisory board together, conducting a policy scan, and then another thing I would suggest folks do is actually holding hearing sessions for different levels of staff at your organization. So you got your advisory board together and you decided, okay, we're going to do training for all the staff and we're going to start up, clinical programs for LGBTQ youth. If you were to take that plan or those ideas to your staff, they might highlight areas of concern that they have, or they may highlight, they may show support. They may show concern about how would they get referrals into the clinical program without outing the youth. Sometimes they have some really good questions that are helpful to think through. And so I always suggest some type of listening sessions, and this can be advertised in a staff meeting or in a bulletin, however is best to get the word out to staff. But to say, we'd like to hear your thoughts is great. If there's a lot of resistance in your listening sessions, that's so good for you to know, because it's something that you can either incorporate in your trainings, like if you know staff are struggling around certain issues, or it can just help you plan next steps if you need an extra policy or directive to help staff get familiar with the content and goals that you have. The next one is use the information, I just said this, from the hearing sessions to inform mandated agency-wide training. So a lot of times what has happened in my experience is that I'll sort of hear from staff about where their misconceptions are, some of the stereotypes that they believe to be true, and then I'll make sure to take those and put them in my training so that I'm really addressing the needs of staff and sort of meeting them where they are in their own trainings. Then I would say also consider a training the trainers course to get your trainers ready for training implementation. I know not every organization is going to have their own trainers, but the reason I say this is because a lot of times an agency will invest in bringing a third-party trainer in the organization to train all their staff, and then there's no training after that. And the problem with that is that, you could look at training research on all different kinds of topics, but basically once the training has been done, if staff don't continue the conversation and have frequent trainings or at least frequent conversations on the topic, they actually forget the information. So it's really important to try to incorporate some kind of booster training or coaching sessions so that staff can continue that conversation and not miss the things that they learned in training. So I suggest to train the trainers, so you have trainers actually in-house that can continue the learning of the staff along the way. And then after initial training, you want to have a plan to follow up. So whether that's, having little 15-minute booster trainings in your staff meetings, or maybe that's some type of coaching that you would provide staff, but something there will be really helpful, because again, you don't want to spend a bunch of resources and time training your whole organization only to have them forget all of that information. So the last few things here, I really suggest having some type of liaison that the staff will know they can go ask SOGIE-related questions to. So this could either be a trainer that you have in your organization. It is probably most of you on this call, right, if you're doing a lot of diverse SOGIE work. But someone on staff that people know, this is the person, if I have a case and I don't know what to do with this case, I don't know how to handle this special circumstance, the staff have some outlet to go to this liaison and ask questions and get information and resources. So that's something that has worked really well in a lot of agencies that I've worked with. And then I would also suggest that when your agency is ready and you feel like your staff are in a good place and people are ready to be affirming and open, making your agency look affirming can also be really helpful to open the doors for folks. So if you could have signs that say this is a safe space, or we welcome all different kinds of families, it may be as simple as like magazines in the waiting room with diverse families posted on them, or pamphlets in your resources that show, LGBTQ resources in the area. Those types of things can communicate messages of safety and openness for this population. But I would say I see a lot of agencies do this before they're ready to do it. So they'll have safe space signs up and they'll say, we're an accepting organization. You're safe to tell us who you are here. And then the staff aren't ready for that. So when a young person comes out or a family comes out in the agency, they may have this poor experience with a staff member who reacts negatively or their body language is off. So I say, do an assessment, after staff are trained, and, if people are feeling ready and, your staff have great attitudes about this population and they're ready to dig in, that's sort of when you want to put up the signs that are like, we're a welcoming organization. Otherwise, you don't want to sort of like send mixed messages for folks, because if they do have a bad experience, they're, likely to sort of shut off and not share who they are with anyone else in that organization, and that's sort of, you want to avoid that. And then the last thing that I would say here is that it's really helpful to get a list of resources and programs put together that your staff can use for children, youth, and families in your area with diverse SOGIE. So, if you are in a rural area, that may be a city, the next major city, maybe it's hours away, but whatever you have that's close to you, or at least like reasonably close, that have resources for this population, it's great to have those resources compiled in one place that folks can use when they're working with this population. So I definitely suggest that as sort of an easy lift and next step for folks working with people with diverse SOGIE. So those are just my quick and dirties. Now, in each of those quick and dirty tips, there are multiple steps and tools out there and resources you can use. And again, I really am very open and happy to work with people on that. If you're, tackling any of those steps, or if you have questions, I can definitely give you some more information on how to get that started. So I'm going to pause here and see what questions I have that haven't been answered yet.
And we'll just take a couple of minutes for questions right now and try to leave time for more questions at the end after our other two presenters have also spoken. But if anybody has something immediately that they want to ask Angela, also there, as she mentioned, she can work with y'all going forward, and there's also a nice list of resources at the back of this PowerPoint that will also continue to provide some additional guidance and information. But any last questions right now in the chat box before we move to our next presenter? That was really informative, Angela, and I hope met the needs of most of the folks on the group. As we saw in the beginning, we've got a wide range of folks with different levels of experience in working with this population, but I mean, that was a great orienting presentation with some real practical tips, I think. I see one question coming in. We'll take that, and then we're going to move to Rob's presentation. It looks like Patricia's typing in a question. Well, maybe not. So, okay, well, Angela, thank you so much. That was very informative and helpful. So now I think we'll move to Rob's presentation. And Gary, are you going to move the slides? Thank you.
Hi, everyone.
So Rob,
hi, everybody. My name is Rob Warnoff. As Angela said, I'm Executive Director of an organization called Sanctuary Palm Springs. We're a transitional housing program for LGBT-identified foster youth, 18 to 21 years old, located in Palm Springs, California, and we accept youth from throughout the state. also, as was mentioned before, I've had the very good fortune of working in every state in the country and seeing how different jurisdictions respond, do all the things that Angela just went through in terms of setting up committees and doing training and revising policies. And these really are not limited to the urban areas. They used to be a very long time ago, but not anymore. And this work is really going on and has been going on for quite a long time throughout the country. So I just want to provide just a little bit of context. One of the reasons I got to travel around the country so much is in 2003, the Child Welfare League of America, which is the nation's largest association of child welfare providers, got some funding to start a national initiative working with states throughout the country to improve systems of care for LGBTQ youth. And that actually grew out of a study that Lambda Legal did in 2001 called Youth in the Margins. And I want to bring this up because one of the states, they interviewed administrators in states throughout the country around if they had policies, if they did training, if they had any kind of services for these youth. And in one of the administrators in one state, in Montana, which is largely a rural state, simply said, it's not a problem in Montana. We have no gay kids in Montana. And I think that really highlights if you don't want to see somebody, you won't see them. A couple of years after that statement was made, I was doing a training in Montana at a group home for 16 girls who were all teen moms. And of those 16 girls, 4 identified as lesbian and 6 identified as bisexual. In the state where the administrator said, we have no gay kids. So you can really see the kind of the dichotomy there. This first slide that you see in my high school when I came out, I didn't know who to go to, so I searched online. They had every site blocked that had the words gay, lesbian, transgender, etc. I could go to a site to find out how to kill myself, but I couldn't find anything about myself. Where I heard this statement was because where Lambda's study focused on the administrators in the states, we wanted to hold those listening sessions and really hear what the young people had to say and the social workers and the caregivers who worked with them. So we did forums all around the country. And this was a statement that was made by a youth in Colorado. Next slide, please. We decided to hold the forums, again, not in large cities. We did hold them in some, in New York City and San Diego and Minneapolis, but also smaller areas like Augusta, Maine and Jacksonville, Florida, Salt Lake City that I'll get to in a moment. But I wanted to highlight the work going on in Jacksonville, Florida with the Jacksonville Area Sexual Minority Youth Network because it was simply started by a youth. It was started by a teenager who said, I'm a gay kid. I have nobody to talk to, no one to support me. So he and his sister sat down one evening in the public library and called themselves a group, a support group. And the two of them talked, and then word got around at the school that there were conversations around these issues. So more and more young people started participating, and that grew into an organization. So really the definition of grassroots, but literally started by a young person. It became Jasmine has such good relationships with the LGBT youth in that area that we had more youth attending the forum in Jacksonville, Florida than we did the one in New York City. Next slide, please. The reason that we held a forum in Salt Lake City, and I just want to tell this really quickly, was because I got a call from a state social worker who said they had a case of a 15-year-old girl who was lesbian identified, who had been living with the same foster mom since she was 7 years old, and had a good relationship with the mom, felt she could disclose her orientation to her. The foster mom then bought a bottle of vodka, gave it to a boy, said, I'm going to work late, get her drunk, literally, and rape her. Because if she had sex with a boy, she thought that that would make her heterosexual. So you can see the stakes here are very, very high. So we did a forum in Salt Lake City in Utah. That ended up being the largest forum we did in the country. Next slide, please. As a result of that forum, the Tides Foundation funded the Utah Department of Children and Family Services and the to continue the work in throughout the state of Utah. Next slide, please. I'm going to go through these pretty quickly. Utah became the first state to require training, LGBT training for all of its state social workers, and more than 2,000 social workers were trained through that. Next slide, please. And continuing funding allowed that state to hold more listening forums, and it's the only state to date that has held additional. They did 6 forums all around the state. And at the end of these slides, you see resources. One of the resources there is called Out of the Margins, and that's a book that we wrote around these listening forums And one of the things that you'll find in there is how to do it in your area. So it's a step-by-step kind of packet about everything you need. They're very low-tech, very easy to convene, and will get you a lot of good information. Next slide, please. So these are obviously the issues that not only came out in Utah, but in everywhere. Safety and protection from assault, from harassment, from rape, better foster placements, addressing rampant homophobia, more understanding, and of course the bottom line is maintaining their human dignity. So I know I went through that very quickly, but are there any questions?
Any questions for Rob? That was very fast. A lot of information. So I think what we can do is go ahead and, if there aren't any questions for you right now, Rob, maybe let Jessica make her comments and share her experience from Texas, and then come back maybe to the resource list to hear from you and Angela about the resources and take any additional questions at that time.
Sure.
Great, thank you. Jessica, are you ready?
Yes, can you hear me?
Yeah.
Okay, great. So I am going to take just a little bit of time to tell you about what we have going on here in Central Texas, and then a little bit about our organization and the efforts that we've taken thus far to be as equitable and inclusive to the diverse SOGIE population and the youth that we work with. So I will start by saying that we are a part of the local mental health authority here for the Heart of Texas region. We serve 6 counties in this area, which is a total of about a little less than 450,000 people for the population for all 6 counties. And so we serve several counties, but they are comprised of lots of small rural towns. And excuse me, the section in which I particularly work with is known as Clara Center for Families, and Clara Center for Families is just one of the many organizations that's a part of our local system of care, known as you can see there in the graphic, Our Community, Our Future. We are trying to, as a whole system of care, be more inclusive and equitable for the diverse SOGIE population and the youth that we work with. So I want to go into a little bit more detail about specifically my area of work within that broad umbrella here in Central Texas, which is our new Youth Crisis Respite House that we have started. And so it is a respite care facility that's a living room model that serves adolescents aged 13 to 17 in our community going through mental health crisis, who are allowed to stay and live in our facility from anywhere to 1 to 7 days, depending on the crisis that they're going through. And we also serve homeless youth in our community that allows them to stay in our facility for, a little bit longer, no more than 30 days. So the examples that I'm going to be giving in the work that we're doing towards these efforts are going to be, just for your context, mostly through Clara Center for Families and the Youth Crisis Youth Crisis Respite House. It's a mouthful. Still getting used to it. So I will go on into just some of the efforts. Were you all able to see the next slide?
Mm-hmm. Yes.
Great. Okay, so the first thing that we did when we started talking about how we were going to be more inclusive of diverse SOGIE populations throughout our community with Our Community, Our Future system of care is going through how we can change from the very beginning of basically paperwork. As a local mental health authority, we have lots of paperwork, lots of documentation that has to be done for funding purposes, of course. And so we started from there, which was how can we make our documentation, our paperwork, our policies that the families are seeing as inclusive as possible. And so that included many meetings of going through literally every paper that we had to see the way that we were asking questions, the way were we giving multiple choice answers? Was it going to be a fill in the blank for people to do how they identify themselves? Did we have policies and procedures in place that included, us being having anti-bullying rhetoric and those sort of things. And so that was about a 6-month process before we really did anything with that. And so once we had that in place and we had the approval from our executive director, we kind of rolled that out and had informational meetings for the staff members so that they were aware of the changes that we made on all of our paperwork and all of their documentation so that they would accurately be able to not only utilize it but describe those things to the families that we serve. And then after we were able to do that, we started putting into place procedures specifically for our youth crisis respite house because it is a residential setting where they do live and sleep there, albeit short term. There are some, like Angela said, some different things that, challenges and hurdles that we weren't equipped to face before. And so we started thinking about procedures for things like room assignments, bathrooms and showerings, as Angela gave examples of, and what we would do about that and how we were going to make that a kind of mandatory enforcement for both staff and the youth that we serve. And so we had those procedures created, and I will say, just since we're giving honest personal feedback, and we did have some pushback in our community from even stakeholders that are on our system of care organization about the decisions that we did make about being inclusive to the diverse SOGIE population that while they're staying at the Youth Crisis Respite House. And so we just had to have honest conversations about that with community stakeholders and kind of present facts on the importance of why we were making the decision to do that and kind of go from there. And I won't say that we got 100% support, but enough so that we were allowed to make it a part of our procedures that we are not going to room necessarily by gender identified at birth, but each youth's own personal gender identity. And we came up with procedures all the way down to how are we going to, navigate house meetings with the youth and families that are staying at our house at the time. How are we going to navigate conversations with staff? And we got that all down on paper so that we were covered, and we knew that we really had a kind of a leg to stand on, so to speak, when enforcing these procedures that we decided were very important for us as an organization as a whole. So that was kind of the first step in our kind of journey that we've been going on. And I'd say the second one, as you can see, is we started a youth support group. Myself and 3 other staff members wanted to provide direct care to our youth that we serve. We serve around 650 families total, and within the organization of Clarence Center for Families, and we each have different roles within the organization, and we all have seen throughout our different roles how many youth are so badly looking for support with their parents, with other youth, and adults in the community. And so we decided to start a support group, to be perfectly honest, without really any knowledge at all of how to run a support group, but we just were passionate about it, and we knew our youth needed it. And so we started kind of an open forum group where we came up with some ideas of things that we thought youth in our organization might want to talk about, and then we kind of let them lead from there. And we publicized that throughout our facility and online, and we didn't necessarily try to target youth because we wanted youth to be able to keep their own experiences confidential if they desired. And so we just posted and advertised that the group was starting, and whoever wanted to join, a way to contact us to do that, and then provide information further from there. And to our surprise, the very first group that we started had 62 people have inquiry about interested in being a part of the group, and we were quite overwhelmed because we did not expect that at all. And so we just kind of ran with it, and we've been going with it for the last about year and a half almost. And like I said, it's all youth-led, and we've gotten some knowledge in the past couple of months, being able to go to trainings and such as the the staff members and the leaders. That has been wonderful, that we've been able to bring back information to our youth in the support group. And so we've had some ebbs and flows, and we've had high numbers in the 60s, and we've had weeks where we had low numbers, as many as just 5 or 6 youth. And but we found that our youth want to be educated and want more information about their rights and the resources that we have in our community. And so we just try to provide that with them, as well as just an open space for them to be accepted and included. And so that's definitely a journey that we're going on. That is definitely not perfect, but we're rolling with the punches here. And then the next thing is that we are working on educating our community, and so that's a very small effort with, again, out of our entire staff of about 70 people, we have about 3 that are interested in doing this, but we are trying to just take charge and be able to educate the community in as many capacities as possible. And so what we have decided, because we do work with youth, is that our efforts are best spent trying to educate schools. We have been fortunate enough where we have had a few schools, districts in our area that have requested more information, and so we were able to go out and train staff, after-school organizations. We've even had one school district that had, everyone from the janitors to cafeteria workers all wanting this information, and we got to do kind of a dialogue discussion that we facilitated. And so we have initiated those conversations with as many schools as possible. And then there are other schools, as you can imagine, in rural areas in Texas that are not so open and are not really interested in any information. And so we've kind of just taken charge that we are going to, regardless of what they desire, we're going to let them know the information that we have and that we're here to share it, and then hope that they come around and hope that we have the opportunity to give them more details, more resources, more ways that they can serve the youth, because like was stated before, it's not because of a lack of youth experiencing these things. It's more a lack of awareness on other people's part, and so we know that the issues are there. We serve those clients here in our organization, and we're just continually going into different school systems and trying to make nice and getting to know school boards and superintendents and things like that, and just letting them know that we're here as a resource when the issues arise in their school system, because what we know from history is that they're going to arise. And that's kind of the approach that we have taken. And then the last thing quickly is that we have the opportunity, like I said, a few of my staff members and I have different capacities here in our organization. And so one is would be a traditional therapist counselor, the other case management, and then another one of us that is an intake worker. And so we kind of get all approaches. And so we have the ability to have contact with our families and our youth on different spectrums of their services here in our organization. And so we've just started by being individual clients, advocates for our clients. And so whether that is, we've had so many youth that's in our support group that doesn't know how to navigate the conversation within their schools of, what bathroom they want to use or what locker room they want to use and things like that. And we have just taken charge of being those advocates for them and being the voice with them to support the decisions that they have made and want support in. And so we have found that it is very helpful to know your information, know the laws that are in whatever location that you are, because if you know your rights, you're able to advocate for yourself, and that's one of the things that we try to instill in our youth, and so we have to do that ourselves. And so the staff and I have had the opportunity to sit down with some people that can explain the laws within the school systems that we work with, and what is state law and what is not, and what's up to the school system and what they do have to allow and not have to allow, so that we can walk into a school and advocate with our youth, having as much knowledge as possible. And so that's been a journey as well. We just try to gather as much information as possible so that we can help support our youth along their journey. So that's about all that I have in a very succinct, well, I tried to be succinct way, and then I guess we can move to questions if anyone has any.
Thanks, Jessica. That was really interesting. Yeah, does anybody have any questions for Jessica right now?
This is Angela. While we wait for questions, I just had two thoughts as Jessica was talking. One thing that might be helpful for folks who are in areas where, let's say, the law doesn't necessarily support the work that you're trying to do, one thing that can be helpful is looking up the ethics guidelines and sort of the rules of conduct that some of these professional associations have, especially if you're in a licensed position. So if you're talking to other mental health providers, looking into some of the associations that they may lean on for practice guidelines, most of the credible associations all have guidelines that support this work, so that might be helpful if you don't have laws you can lean on. And the other thing I would say is that if you're in the position where you're doing training and you're not getting a lot of buy-in for the training you're doing, like let's say you only have a handful of people signing up, sometimes it's helpful to reframe the training as, maybe from an intersectional lens. So maybe start off your training series not just talking about diverse SOGIE, but you might talk about other marginalized groups too, so that within that community, someone may not be interested in diverse SOGIE, but maybe they're interested in, race discrimination or racial equality. They may come to the training and then learn a whole lot that they didn't expect to learn. And in doing that, you're sort of creating common ground among different groups, and that is also sometimes an effective way to build some support where you may not already have it. So those are just two thoughts I had that popped up.
Thanks, Angela. I mean, we're quickly running out of time. Do you want to say anything about any of these resources listed, or they're pretty self-explanatory?
This is Rob. I can
Okay, please.
Talk about those quickly. Just about everything on this list is downloadable as a PDF. They're free. You can access them. They have the websites where you can access them. And one of the things when Angela was just talking about the state laws, the It's Your Life, A Guide to Legal Rights for LGBTQ Youth in Care, that was developed by the American Bar Association, those are constitutional protections. So irrespective of state law, it's how the Constitution, in very expansive ways, provides a lot of support for these young people. So if you're in a state that doesn't have a lot of state law, I really recommend that you look to this guide to help guide your policies.
That's very helpful. Thank you so much. And here's the second page. So you've got two good pages of resources here that y'all can download to help your work. And then wanted to just to leave, here, and again, 2.5 pages, very good. Works cited for your reference. And here's the contact information for all of our speakers today. And I think they would all be willing to engage with y'all with some follow-up conversation. They've offered to share their email addresses. So please don't hesitate to reach out to them or reach back out to myself or Sarah at the TA Network if there's any support that we can provide you in taking the next steps with this work. Continue to submit questions to us directly. We can try to follow up on those for you or back to the speakers directly. And I would ask you to please stick around for just a couple of minutes and do the poll to let us know how we did today and to give us some feedback about and encourage you also to suggest any additional topics that you would be interested in the Rural Learning Collaborative looking at in 2019. And